Hey everyone, I'm Sarah Lavonne and welcome back to my YouTube channel. Today I am back for this month's Coffee and Questions. If you haven't seen this before, where I answer your questions from both YouTube comments and then also from Instagram polls. And so today we're gonna talk about a whole lot of random things, including I had a lot of breastfeeding questions. I talk about oversupply, we talk about sleepy babies that don't wanna feed on the breast. I can never remember what they are whenever I try to recap them, but so many helpful things. We talk about tearing inside your vagina. I answer a few of your nursing questions. If you're a labor and delivery nurse, I got you, but also give you the inside scoop on things that labor and delivery nurses go through. We talk about my hacks for pushing. I give you tips on a lot of other things that I can't remember because I had to scroll through all of these questions and figure them out. So make sure you subscribe down below. Make sure you follow me on Instagram. Give it a like, share it with a friend so you never miss a future video. And then stay tuned because if you comment down below with future questions for future videos, I may make an entire video about it or I might answer your question in a future Coffee and Questions. So with that, let's get answering your questions. I'm gonna answer a few of your questions from YouTube and then I'll head on over to Instagram and answer some poll questions over there. So let's get started with YouTube first. I love this one, and actually this one probably deserves its own video. So if you want it, let me know down below and I can make an entire video on oversupply. So this is related to breastfeeding. This comes from Morgan Leary and she says, can you do a video on oversupply, tips and tricks for managing? I feel like everyone prepares you for low supply and supplementation, which is so incredibly true, but no one talks about oversupply, waking up in a puddle of milk nightly, and the effort and time required to manage supply for comfort. So this is a thing, by the way. So with breastfeeding, there's undersupply, and I actually have a tips to increase your breast milk because that is like one of the biggest concerns related to breastfeeding, but there is such a thing as oversupply where you actually make too much milk, and too much milk is entirely relative. So it depends on how many babies you're feeding, if you're pumping and wanting to store, to save, how much supply you want to save. And so this can be somewhat of a blessing, but the risk of oversupply and overproduction is engorgement, which engorgement in general is just when your boobs fill, and that you're probably gonna feel in general when your milk volume changes or your milk comes in. So that in and of itself isn't a big deal, but when that oversupply or that engorgement creates clogged milk ducts, those aren't removed, which can lead to a mastitis, which can lead to a sepsis, and you can end up very, very sick, potentially even hospitalized. And so we want to avoid all of those complications. And so with oversupply, my biggest tip for you, and by oversupply, I'm gonna say that you feel full all the time, you feel engorged all the time, maybe you're at risk for clogged milk ducts, or you just are managing just way too much milk, is only stimulate what you need. And so some people just have this surplus of milk. It's like their bodies were ready to feed a village, where you really only have one baby to feed. And so the more you stimulate, the more you're telling your brain to make more. So what you wanna do is only stimulate what your baby needs. Right now, if you have a surplus and you wanna store it, that's one thing. But if you're like managing having too much milk where you're always engorged and you're dealing with clogged milk ducts and potentially all the complications that come from that, feed your baby on the breast, and when you're done, no pumping, no haka. You can wear a tight-fitting bra, that can help. You can do ice packs on your boobs, that can help to sort of regulate it. I will say too, especially during the first month after your baby is born, it is somewhat normal for your body, somewhat meaning it is normal for your body to be sort of figuring out what's normal, how much to make. You can deal with an oversupply, and usually after about a month, your body regulates, but that's only if you're sort of limiting the stimulation to your breast. Hopefully not going the opposite direction where now you're dealing with milk volume issues, right? And so we wanna balance that, removing just as much as baby needs and then avoiding any kind of extra stimulation and extra removal of milk, because the more you remove, the more you tell your body, well, make more. And then you keep making more, and then you have a lot of more milk, which is basically an oversupply. So that's my initial tip for you. If you want more on oversupply, I can do a whole video. I have lots of tips for oversupply. And actually, recently I've had a good number of patients that have dealt more with oversupply, which can potentially be more complicated than an undersupply. So let me know. Thank you for that question, and I hope it helps. D Tally says, is it normal to leak breast milk before the baby is born? I'm on my 4th pregnancy, and this is a first for me. So the answer to this is overwhelmingly no. Everybody take a big deep breath. I can't tell you how many clients I've had who are like trying to express their breasts while they're still pregnant and so stressed out that they have no milk and thinking that it's getting in their head like, I'm not gonna have milk. Your body doesn't know to release the milk until you've birthed your placenta. I was gonna say have your baby. You also have to deliver the placenta, and once the placenta's out, that causes the hormone shifts that says, oh, well now like let the milk out that's been sitting there for weeks and weeks and weeks. So deep breath, everyone. It is not normal. If you leak before you give birth, great, you know, and you can kind of especially rest assured and just go, I'm good. I know I have milk. You may not see a lot. Please don't stress about that. Your body is telling you to hold on to the milk until the placenta is born. No big deal. You got it. Not Claire says, are there any other good energizing essential oils to use during labor other than peppermint? I love essential oils. I actually, behind here up there is like my entire collection. I have basically the entire doTERRA website in my house right now. I use essential oils for everything. I ingest them. I have like different tinctures and stuff that I use for my life, and then I also use in labor with my client's permission and with the MD knowing. And so what I would say is, if you're gonna use essential oils, let's also remember that they do have side effects that you can overdose. You kind of have to treat them like a medication. I love peppermint for energizing. My favorite combination though for essential oils is peppermint and orange or wild orange or some sort of citrus, even like a citrus bliss. I know doTERRA, that's just what I'm used to. That's sort of what I grew up on. And so I know like there's Young Living and there's like an Intermountain something. You can link your favorite essential oil companies down below. I am not entirely partial. I do love doTERRA because of their purity, but you want to make sure that you have therapeutic grade essential oils. They're pure, they're not chemically extracted. A lot of the cheap ones in the grocery store or whatever, they're like mixed with alcohol, and then they take away the benefit of the actual pure essential oil. Essential oils in general are very safe for pregnancy. It just depends on what the oil is. And so in general, make sure you're checking in with your provider, make sure that they're cool with it before you put anything on your body that could potentially affect you, your life, your baby. Mind you, like an orange and a peppermint in general for pregnancy are entirely safe. So that's my favorite combination of essential oils. I have that going in my office or my life pretty regularly. That's kind of my go-to. The other ones for energizing, I would say, are anything citrus. So a lemon, a tangerine, a wild orange. There's a citrus bliss that I love that's like very uplifting, and that's gonna help to kind of as a little pick-me-up for labor. Leah Bynum says, would it be weird if I hired a birth photographer when the time comes? When would they come to you? Like, would they come when you first have a contraction, at the hospital? When? So let's talk about birth photography because I am obsessed with birth photography. I do feel like my skills at the bedside have gotten much better, and thankfully for the iPhone and portrait mode and all the things that you can do with these fancy cameras that we have, now you can do a lot with photography. So if you don't follow me on Instagram, head over to Instagram and follow me over there because I am constantly highlighting beautiful birth photography. If I could, I would recommend, and if everyone could afford it, I would recommend having a birth photographer at every single birth. I think you hire people to photograph these like really special moments in your life, and if you hire a birth photographer, they are so incredible at capturing moments that you otherwise wouldn't be able to remember, and moments that are classy. They can do it in a way that's modest potentially, and especially if they're allowed in the hospital, given the fact that we're still in the middle of a pandemic right now. I totally encourage you, if you can afford it and you have someone in your area that you love and that is a birth photographer, I will link my favorites down below. I am sure that I have highlighted them on Instagram so you can check them out there. I know in LA, Art Shape Photography, which she just renamed herself, so I will link that down below. I apologize. She's one of my favorites. I love Alexandra Mooney is one of my favorites. She's gonna be in the Midwest. So check out Instagram and find yourself a birth photographer. Typically, they're gonna come based on their packages. So some of them may come with you at home. Some of them may go with you to the hospital, depending on the policies and procedures there. In general though, I would say have them at all stages of labor. So if they come in the early stages when things are pretty mellow, they could even go home and nap and come back when things pick up. But it's so nice to have the progression and the connection and like sort of document the story of your labor and birth. And so I would want them there the whole time. Probably not at the sign of first contraction, but in general, early labor, active labor, at the hospital, pushing, birth, postpartum, all of it. document it. And at the bare minimum, whoever your support people are, and hopefully not your partner, so like follow-up support person, your doula, maybe like a family member that's coming with if you have one, always have them on photo duty with their cameras, because even if they're not the most like professional looking photos, to have photos of those moments is so incredibly special. And you'll cherish it forever. And I love it. So I would say, no, it's not weird if you hired a birth photographer when the time comes. Go for it. I love it. And then make sure you tag me on Instagram because I want to see your beautiful birth photography photos. Abby Durrington says, have you heard of the Aniball? This comes from a vaginal tearing video. She says it's a device to help prevent tearing. So I have heard of the Aniball. I have had multiple clients try it and use it. Honestly, anecdotally, I haven't seen really any difference in terms of if people tear more or not. And it's basically a device that you like put inside your vagina, and then my understanding is you pump it up to kind of help stretch the tissues. So it would be in lieu of a perineal massage. So if you don't have access to an Aniball, which my understanding is they're pretty much only available in the UK, now that I remember, I have a client that like was supposed to bring me back one, but I need to follow up with that because I would love to see one. And so if you're in the UK, let us know in the comment box down below if you used it, how much you tore, if you feel comfortable. In general, I think it's gonna replace a perineal massage. So that's the other thing you can do at home to help prevent tearing and help soften your pelvic floor, is that you or your partner could help soften. I do have a perineal massage guide in my store, I like almost forgot about, but it's there. I will link it down below so you can check that out, and then you can help have like a tutorial of how to perform perineal massage. That's also a potential video idea. If you want it, let me know. I can pull out my vagina model and give a little rub and show you how to do it. So let's head over to Instagram and answer some questions from the poll that I put out there on Instagram. There are so many questions here. I'm just gonna scroll and like just stop and choose one. I have nothing prepared for this, so let's just wing it. Alex Micken, with no vowels other than the A, says, a tilted uterus, will this affect my labor and delivery? My answer to this is probably not. So a tilted uterus, uteruses are usually like a ball or like a round thing, structure like this inside of us. And sometimes they're just facing forward or facing back. And so typically prior to pregnancy, it's not necessarily gonna do anything. It sometimes can make you more prone to miscarriage. But what happens is once there's a baby in there and it's growing, even if it's tilted forward, it kind of like grows into wherever it can go and it gets much less tilted. So I wouldn't stress about it, not a big deal. We don't even know because your uterus is gonna grow wherever it can fit in there and probably not be tilted anymore. Yoxberry says, is it normal that pregnancy kicks hurt? Not all the time, but there are some that are hard. Yes, unfortunately. And sometimes you're like, whoa, I see that all the time. If you haven't seen my fetal kick count video, make sure you check that out because I do talk about fetal movements and kicks and stuff. But yes, I'm sorry that it hurts, but you just have a really strong exercising baby in there, future soccer player, football player. This is so cute. Do you miss Carlie Bauchi? I don't even know if I'm saying her name right. Carlie, I was the one she called you about back a couple months back. We are fortunate to have her. What an amazing soul. I love her. Shout out to Carlie. Carlie actually helped me name Bundle Birth back in the day. That's one of my old coworkers. That was just like a funny one that I saw. How cute. Ooh, I like this one. Lots of breastfeeding ones today. Okay, Taylor Jade 04 says, all my baby wants to do is sleep and not latch. Help. Okay, so it totally, there's so much I could say about this. Okay, I'm clearly very excited. I'm like out of breath. All right, so in general, if your baby is too sleepy to latch, it totally depends on how many days of life, because if they're too sleepy to not wake up, that could mean that they're not getting enough and that they're actually potentially hypoglycemic, like we care, okay? But if especially it's during the first few days and the first day of life, this is very common. My recommendation to you is actually to manually express into a spoon and then transfer that to a syringe and syringe feed your baby all the excess. We had to do this with my nephew Dakota because he was just too sleepy. Like we go and we try for however long and then you end up frustrated and sweating and like irritated and you're like, oh my God, and then you're discouraged. None of that. totally unnecessary. So instead, manually express or put a haka on or put a breast pump on for a second and then syringe feed them or bottle feed them. Either one is gonna be easier. The syringe feed probably a little bit easier just to give them enough sugar. Sometimes that's enough to just kind of wake them up if they're a little bit hypoglycemic, but we really wanna be careful with those really sleepy babies that there might actually be something wrong that we want to identify. But if they're not able to latch because they're so sleepy, put them skin to skin, unwrap them, make them kind of cold, wake them up. Hey, let's play a little. Be kind of obnoxious and see if they'll kind of perk up. Because sometimes I know for me, like in the morning, I'm like, oh my God, I can barely talk until I get my coffee. So you gotta like turn on some lights and like walk around and give me a second before I'm ready for breakfast. And that might be sort of the case with your baby. Try those things. And then if not, manually express, you can watch my manual expression video into a syringe feed them, and then just keep going. And eventually, hopefully they'll perk up. If they continue to be that lethargic for like say a whole day, and remember our rule for feeds are 8 to 12 in a day in 24 hours. So however you want to space them, we don't really care. We want a minimum of 8 feeds in a 24-hour period. And then we want to make sure that we're getting our diapers, at least 6 diapers a day, 6 heavy wet diapers a day. Plus you'll probably get more eventually, but as long as you're getting those things, you know your baby's getting enough. I love this question. For those of you that don't know, one of the things that Bundle Birth has been doing over the last year-ish has been, well, more than a year, because I've taught a class for more than a year, but we have Bundle Birth nurses. So I train labor and delivery nurses all over the world, and I love when there's questions that overlap both specialties. So Sabrina Fair says, is it reasonable to request to ask your nurse to take a few photos throughout an unmedicated birth? I love this. So this is a total flex and flow answer. I think it's reasonable, 1,000% yes, but you have to understand that that can't be their primary goal in that moment because they're there for safety. So if there's something wrong, they need to be able to assess and be able to like identify what's going on. They may have another patient that they're in and out of the room with. They're not probably going to be at the bedside the entire time. And so you could say, hey, we have this camera here. Would you be willing to take a couple of photos here and there? I know for me, I was always like, yeah, I love it. Let me try to get like a good angle and make it really artistic and throw it on portrait mode and like lighting better and stuff like that. But you may get a nurse that's like really excited about it. You may also not get a nurse that's not so excited about it and or like doesn't necessarily have those skills. It's not expected of them. It would totally be bonus, but you absolutely can ask. And I think probably most people would be kind of excited to be able to help you so long as they have the time. Well, Kayla Baum, I've been a pediatric nurse for 5 years, newly got an L&D and postpartum job. Any recommendations for learning strips? It's been a long time since nursing school. If you're new in labor and delivery, my recommendation to you is take our 12-month mentorship program, and you have an entire module / class on external fetal monitoring and looking at strips and all of that. So we got you there. Sign up for mentorship. I will link it down below if you're a labor and delivery nurse, and spread the word to all other labor and delivery nurses. Mide527 says, is it possible to completely empty using hand expression method, or is a pump required? You 100% could empty your breasts by hand expression. And sometimes like people will hand express and they'll get a lot really quickly, and other times people have to work pretty hard. And that's why watch my manual expression video, because that should help you to get more with less effort. I will say, depending on your milk volume and your stage in lactation, that it may be a lot of work. It may feel like your hands are falling off by the end. And so I would definitely recommend having a pump if you have access to a pump, but manual expression is totally acceptable, totally effective, and definitely a way to empty your breasts. Ooh. Schwendizzle. First of all, you have the best handle. Schwendizzle says, itchy hands and feet after going for a walk. Is that something I should tell my OBGYN? Schwendizzle, I love this question because you absolutely actually should tell your OB if you have itchy hands and feet, because that can be an indication that you possibly could be developing a condition called cholestasis of pregnancy. So any itchy hands and feet, please pass it on. They're gonna check your bile acids in your blood. It's just a quick blood test. And then really the indication would be if you do have cholestasis, you're probably looking at a 37-week induction of labor. So if you want an entire video on cholestasis, let me know. But if you have itchy hands and feet, the answer is yes. Make sure to tell your OBGYN. Oh, this is sweet. This is Sharona, my Sharona. I'm so funny. That's the first time I'm sure she got that. Sharona says, how is life going for you right now? That is so cute. I am loving life. you can ask more specifics. I know I did an about me about a year ago, and life has shifted in the last year. Bundle birth nurses has exploded. That has been taking all of my time. I have never worked harder in my life, which I thought I'd said before, and now like this last year is tried to kill us. Mind you, I love my work so much. It is so fulfilling to me, and to be able to make an impact for you in the hospital setting through labor and delivery nursing has just been a dream come true for me. And so that's been really my focus for the last like year-ish, but the shift is coming back to you guys. I don't know if you've been on social media or follow me on Instagram for a while. I know I've been like a little less engaged in the last year-ish, and that's just because I've poured so much into bundle birth nurses, but it's coming back. There are some really exciting things coming that you will find out on Instagram and then through here. My personal life is going really well. I am very happy right now. And that's all I'll say about that. Rebecca Davis says, do you have any hacks for pushing? My OV got me to do tug of war with a towel and it worked. So many hacks, but I have to like be there and know what's going on with your pelvis. I think knees together is my biggest hack, and that has gotten super popularized on Instagram, but it opens the bottom part of your pelvis. And so a lot of times you think about and you see in the movies where it's like knees are back to your like ears practically, and if you bring your knees in and open your legs like that, where it's like knees in basically, feet wider than your knees, it actually can help to create more space in the lower part of the pelvis. So that's my quick tip for pushing. Get my position guide because I have tons of pushing positions on there and other positions for labor. I can link that down below. That you can bring it. Also leave with your favorite nurse as a gift. Side tip hack for labor and delivery. Ooh, A Huddle says, how common are internal vaginal tears? I've never heard of it until it happened to me. I've gotten this comment so much on my vaginal tearing video, which I think needs a refresh because I have some other things to say, and now that I've learned about your questions, I feel like I could redo that video. Let me know if you want it. Internal vaginal tears are actually pretty common, all right? So if we were to grade them in terms of like textbook tears, there'd be 1st through 4th degree, but you can actually tear up to your urethra, up to your clitoris, ouch, into the vagina, off to the side. A lot of times they'll call it a skid mark, where it was just like a little separation of the tissues, like a scratch. Maybe it was like down the side of the vagina. All of the above, really you can tear anywhere, hopefully not into your cervix, which is way inside, all of which is normal. Sometimes requires stitches, sometimes doesn't. So long as it doesn't go all the way through to your rectum or something, that still would be considered a 4th degree tear, depending on how much of the tissue is involved. But most of the time we talk about tears, we talk about like the space between the bottom of your vagina hole to your butthole, but it really can happen anywhere. So pretty common, definitely. So the answer is pretty common. Oh, I love this. I wouldn't have thought of this question. Okay, I'm about zippers. I have questions about your handle. What do you mean you're about zippers? I like zippers too, but I've never like thought about it enough to like care that much. So please tell me more. She says, worth it to do a birth class for baby number 2 when you remember most of it, the class for baby number 1. So here's the deal. I would say if you remember everything, maybe not, to be honest. But I will say doing a coping with labor class, again, to me is a great way to connect with your partner, to sort of get in the mindset of birth, to remember some things maybe you did or didn't do last. There is such a thing as a refresher class, so like a short and sweet nitty gritty, let's just hit me with all the quick facts to like refresh my memory class. But honestly, I feel like especially if you're watching my YouTube videos, if you've taken my class before, and now it's round 2. First of all, you get lifetime access, so you could access it again, watch it at double speed, and then maybe not. But a coping with labor class, yes. And infant safety and CPR, yes. Because even for me, who's a nurse, I've resuscitated many infants. I think it's important to like refresh yourself so it's fresh in your mind and you're able to respond versus like, how was I supposed to do that again? Oops. You definitely want to know those skills. And last but not least, this could go for pregnant people or nurses, and this is from Katie Mummy, who says, I feel like L&D has its own lingo. How the heck can I learn it all? She's probably a labor and delivery nurse. So what I would say to this is surround yourself with the birth community, that the more exposed you are to birth, the more you start to pick up on things. Obviously, there's books to read. You can check out my Amazon list. I have like tons of lists, like even like fashion finds on Amazon because I save everything I like to there. So that is linked down below. You can check that out. But look at books, read, kind of like pick around different, to me, I think Instagram is really easy, or even TikTok, where you can find different videos where you're sort of just like starting to, it's all that input where it sort of starts to become a part of you. And then when you're at work, just pay attention. If you don't understand something, one of my phrases I use in mentorship is, I'm not stupid, I'm just learning. And that to me, I use currently in my life with a lot of things, like even in business and stuff, where I'm like, I'm not stupid, I'm just learning, even though I kind of feel stupid at this moment because I didn't know this, right? If you don't know something, you don't know something, and no one expects you to know everything. And so whether you're pregnant or a nurse, that as you start to hear some of this stuff and you start asking questions and getting curious and looking things up, that will help you to start picking up the lingo. It's also just exposure and repeated exposure for remembering things. You can study, make yourself some flashcards, take our mentorship, come to Physiologic Birth, stuff like that. The more you input, the more you're gonna be able to start to get with the L&D lingo. Thanks everyone for being with me here today. If you want more from me, I have childbirth classes online. We do have this new position guide online that's super helpful for your labor and birth. I mentioned it before, but that can help to facilitate a easier, faster labor. I'm not making any promises, but it is super awesome and it's been really, really helpful for other families. If you want other information that's not on here, you can head on over to Instagram and follow me on Instagram. Make sure you subscribe down below so you never miss a future video. And then make sure you check out the playlist down below too, because at this point, I've been on YouTube for a hot second and there is a lot of information here. And so you can kind of pick and choose based on the theme that you want, or you can just go in chronological order. I got that question this week too of like, how do I start consuming your stuff? I'm like, just start somewhere. Just click around, play it while you're driving, and you'll start to kind of even get that L&D lingo into your system and help to make you even more prepared for your upcoming labor and birth. If you're a labor and delivery nurse, make sure you follow Bundled Birth Nurses on Instagram, and then make sure you head on over to our website and check out all the extra fun things that we have there for you. And then until next time, don't forget to flex and flow, and I will see you soon. Bye. Which is oh man, I just realized my thingy is undone. Let me button up my shirt. This looks really tight, like I'm like a bulging bodybuilder. But I promise it's not muscle. Totally side note, one of my first boyfriends was named David Talley, so like, shout out to David Talley. Why am I saying that? I can't see D Talley without thinking of David Talley. Shout out to Dave Talley. Oh Lord. Okay, I have heard of the Aniball or Aniball. Anus. One of the things that Bundled Birth has been doing is there for the inside scoop on labor and delivery nursing. Why does my voice sound like? Can you do a video on oversupply? Clogged milk ducts, which is that it?